Atrial fibrillation is one of the most common abnormal rhythms that we have, and it is an irregular and fast heartbeat. So in normal hearts, the top chamber squeezes with each heartbeat, while in atrial fibrillation, the top chamber is quivering very fast, and it put people at higher risk of a stroke, and people can have symptoms out of it. We think atrial fibrillation is from rapid firing in the pulmonary veins, and it is different from the normal rhythm. But we don't really know any specific reasons that causes atrial fibrillation. Well, there are many risk factors for it. Getting older is one of them, and also being obese, overweight, certainly put people at higher risk for atrial fibrillation. And high blood pressure, diabetes, coronary artery disease, or heart failure, they are all put people at higher risk for atrial fibrillation. And there have been studies showing there are some genetic predispositions to atrial fibrillation, but the majority of the patients, they develop atrial fibrillation when they get older. Atrial fibrillation can have a wide variety of symptoms, starting from irregular heartbeat, skip heartbeats. Some people feel rapid heartbeats, and sometimes people can just feel subtle symptoms such as fatigue, trouble breathing. And I have patients who tell me that they don't know what is wrong, but they're just not themselves. So the symptoms can be very subtle. I have patients who describe this fluttering sensation in the chest, and it can be from atrial fibrillation if it's very common, but there are other rhythm problems that can cause the similar feelings. And the fluttering sensation is just the irregular heartbeat. But in order to know the diagnosis, we will need to see the rhythm, either by an EKG or some monitoring device to see the diagnosis. And then I think the frequency and the severity of the symptoms certainly matter. If it's just once, like every 5 years or something, I don't think that's something we need to worry too much. But if it's every day, every week, or if it's something new, and then I think certainly we should pay attention to it. There are a few things we discuss when we manage atrial fibrillation. Number one is that atrial fibrillation put people at higher risk for stroke. So for certain patients at elevated risk of stroke, blood thinner will need to be started. And then this will be a discussion between the primary care doctor, the cardiologist, and the patient. And then it's really critical to start the blood thinner if atrial fibrillation is identified for patients at higher risk for stroke. And number two is the symptoms that we discussed. It really can impact the quality of life negatively. And then there are a few things we can do to treat atrial fibrillation. It starts from lifestyle modification, and lose weight certainly is helpful. And then drink less alcohol or don't drink alcohol at all. This is very helpful to reduce the burden of atrial fibrillation. And cigarettes is bad for atrial fibrillation. Putting off the cigarettes or stop smoking. These are the lifestyle modifications that we can do to help with atrial fibrillation. And aside from that, there are medications that can slow down the heart rate or maintain the normal rhythm. The issue with the medication is that people need to take it every day, and also the efficacy of many medications is limited, and certain medications can have side effects. And then lastly, we have ablation, and that's a therapy we've been used for many years, has been proven to be more effective than medications. It's a procedure we routinely perform here. And the way it is done is that we go from the groin with catheters, we go inside the heart, and then we deliver high energy shocks to the pulmonary veins where atrial fibrillation is from. And then the procedure takes about 2 to 3 hours. Most people can go home the same day. For people experiencing symptoms suggestive of atrial fibrillation, I would recommend you talk with your primary care doctor, and then an EKG will be an easy start. And after that, once atrial fibrillation is diagnosed, referral to cardiology or electrophysiology would be recommended, because nowadays we begin to realize that it is easier and more effective to treat atrial fibrillation when it is diagnosed earlier.